Hello, my name is Ithar Shaheen, and I will be talking about Piperacillin tazobactam. First of all, Piperacillin tazobactam is a uridopenicillins class sold under the brand names Zocine, Yanovine, and Tazocine, among others. Is a combination medication containing the antibiotic piperacillin and the beta-lactamase inhibitor tazobactam. The combination has activity against many anaerobes, gram-positive and gram-negative bacteria, including Pseudomonas aeruginosa. Zocine is a combination product. Each 4.5 grams vial contains 4 grams piperacillin sodium and 0.5 grams tazobactam sodium in a 8:1 ratio. Dosage recommendations are based on the piperacillin component, unless otherwise specified. Dosing presented is based on traditional infusion method, IV infusion over 30 minutes, and dosing is presented in milligrams per kilogram per dose and milligram per kilogram per day. Also, it doesn't cross the blood-brain barrier, so we can give it to meningitis and sepsis. As for dosage forms and strengths in injection, lyophilized powder for reconstitution. Lyophilized means it was dried by freezing. We have 2 grams per 250 milligrams vial. We have 3 grams per 375 milligrams vial and 4 grams per 500 milligrams per vial. And this is what's used in KAUH. And we have also premix bag, which contains 2.25 grams per 50 ml and 3.375 grams per 50 ml and 4.5 grams per 100 ml. As for storage and stability, the vial should be stored intact at 20 to 25 Celsius. Use single dose or bulk vial immediately after reconstitution. Discard any unused portion after 24 hours if stored at 20 to 25 Celsius, or after 48 hours if stored at 2 to 8 Celsius. Of course, do not freeze the vial after reconstitution. Stability index shows 5% or normal saline has been demonstrated for up to 24 hours at room temperature and up to 1 week at refrigerated temperature. Stability in an ambulatory IV infusion pump has been demonstrated for a period of 12 hours at room temperature. Galaxy containers store at or below minus 20 Celsius. The thawed solution or the dissolved solution is stable for 14 days at 2 to 8 Celsius or 24 hours at 20 to 25 Celsius, and of course do not freeze. Now let's talk about the mechanism of action. Piperacillin inhibits bacterial cell wall synthesis by binding to one or more of the penicillin binding proteins, which in turn inhibits the final transpeptidation step of peptidoglycan synthesis in bacterial cell wall, thus inhibiting cell wall biosynthesis. Bacteria eventually lyse due to ongoing activity of cell wall autolytic enzymes, while cell wall assembly is arrested. Piperacillin exhibits time-dependent killing, which means the more frequent dosing, the more activity. Tazobactam inhibits many beta-lactamases, including staphylococcal penicillinases and Richmond-Sky's type 2, 3, 4, and 5, which is classified according to their catalytic activity, including extended-spectrum enzymes. It has only limited activity against class 1 beta-lactamases other than class 1C types. As for the uses, we use piperacillin tazobactam in the treatment of moderate to severe infections caused by beta-lactamase-producing strains of Escherichia coli, bacteroid species, Haemophilus influenza, Staphylococcus aureus, and by piperacillin tazobactam susceptible Acinetobacter baumannii, H. influenza, Klebsiella pneumoniae, and Pseudomonas aeruginosa. In the following conditions, appendicitis complicated by rupture or abscess, and peritonitis, which is FDA approved in the ages of equals or more than 2 months and adults. Pneumonia, hospital-acquired nosocomial, moderate to severe, which is approved by the FDA in the ages of equal or more than 2 months and adults. Pneumonia, community-acquired, moderate severity, FDA approved in the adults. Infectious Diseases Society of America, American Thoracic Society, guidelines only recommend piperacillin tazobactam for community-acquired pneumonia caused by Pseudomonas aeruginosa or due to aspiration. Postpartum endometritis or pelvic inflammatory disease, FDA approved in adults, skin and skin structure infections, uncomplicated and complicated, including cellulitis, cutaneous abscesses, and ischemic diabetic foot, FDA approved in adults. As for the dosing, susceptible infection in infants at the age of 2 months or older, children and adolescents are given IV 80 to 100 milligram per kilogram per day, divided into 3 to 4 doses, which means every 6 to 8 hours. Maximum daily dose is 16 grams per day of piperacillin, and of piperacillin tazobactam, it's 18 grams per day. The 2 grams here are the tazobactam, basically. Extended infusion dosing, limited data are available. In children and adolescents are given IV 100 milligram per kilogram per dose, infused over 4 hours every 6 to 8 hours. The maximum dose of piperacillin alone is 24 grams. But for instance, Pseudomonas aeruginosa can give it alone because it's a beta-lactamase producer. A high dose of piperacillin may cause seizure, and it becomes more probable when the patient has renal impairment, since it suppresses the GABA receptors. So we should pay attention for this point. Now let's talk about the dose adjustment. In renal impairment, infants and children and adolescents, there are no dosage adjustments provided in the manufacturer's labeling. However, the following have been used by some clinicians. Dosing based on the usual dose, of course, of 80 to 100 milligram per kilogram per day in divided doses every 6 hours. First of all, if the GFR was more than 50 mL per minute per 1.73 meters square, there is no adjustment required. If the GFR was between 30 to 50 ml per minute per 1.73 meters square, 35 to 50 milligrams per kilogram dose per dose every 6 hours is given. If the GFR was less than 30 mL per minute per 1.73 meters square, 35 to 50 milligrams per kilograms per dose every 8 hours is given. As for the intermittent hemodialysis, we know that it removes 30 to 40% of a piperacillin tazobactam dose. So a 50 to 75 milligrams per kilogram per dose is given every 12 hours. As for the peritoneal dialysis, it removes 21% of tazobactam and 6% of piperacillin. So 50 to 75 milligrams per kilograms per dose is given every 12 hours. For the continuous renal replacement therapy, 35 to 50 milligrams per kilograms per dose is given every 8 hours. As for the hepatic impairment, there is no dose adjustment necessary. It's excreted in urine. As for the adverse effects, first of all, although these are very low in percent, only 1 to 4% patients have encountered these adverse effects. And these are diarrhea, constipation, headache, insomnia, nausea, fever, oral candidiasis, rash, vomiting, dyspepsia, pruritus, pain, hypertension, and leukopenia. The more common and which interests us more, the thrombocytopenia, hypokalemia, and increase in liver enzymes within the normal range. At last but not least, I'm going to talk about the monitoring parameters. We should monitor the serum electrolytes, bleeding time, especially in patients with renal impairment, periodic tests of renal, hepatic, and hematologic function. Observe for changes in bowel frequency, CBC with differential, of course, and monitor for signs of anaphylaxis during the first dose. And that's it. Thank you, and we hope this was useful. And of course, the reference was Lexicomb.